Imagine you're at your favorite restaurant. The menu arrives and suddenly you find yourself holding it at arm's length, squinting to make out the specials. You ask yourself, what on earth is going on? Or picture yourself at your desk, leaning back from your computer screen, struggling to read an important email. If you're over 40 and these scenarios sound all too familiar, you're likely experiencing presbyopia, a natural part of aging that affects nearly everyone. Before we dive deeper, I want you to stick around till the end of this video. You're about to learn some crucial information about presbyopia that you probably won't get during a typical eye exam. This knowledge could significantly impact how you approach your vision care. Presbyopia isn't just about needing reading glasses. It's a gradual change in your eyes that typically starts in your 40s. As your eye's lens loses flexibility, it's like a camera that can't adjust its focus. You might first notice it when reading fine print becomes challenging, but over time, even seeing your smartphone screen clearly can become a daily struggle. Unlike other vision problems, presbyopia affects both distance and near vision, which is why you might find yourself removing your glasses to read if you already wear them for distance. It's important to know that presbyopia continues to worsen until around the age of 65. This means that your vision needs will likely change over time. Now, let's address some common misconceptions about presbyopia. Many people believe that presbyopia is the same as farsightedness, but they're different conditions. While both can make it difficult to focus on near objects, presbyopia is related to the aging of the eye's lens, whereas farsightedness is typically due to the shape of the eye. Another prevalent myth is that LASIK can cure presbyopia. Traditional LASIK surgery is designed to correct nearsightedness, farsightedness, and astigmatism, but it doesn't address presbyopia directly. We will discuss some LASIK-based procedures that can help with presbyopia later in this video. Some people think presbyopia only affects near vision, but in reality, it can impact intermediate vision as well. Imagine sitting at your desk, leaning back in your chair, squinting at your computer screen, and still struggling to make out the words. That's presbyopia affecting your intermediate vision, not just your ability to read a book up close. There's a belief that wearing reading glasses will make your eyes lazy or worsen your condition faster. This isn't true. Think of glasses as a tool, like using a magnifying glass. They help you see clearly without changing your eye's biology. Your presbyopia will progress whether you wear glasses or not. It's a natural part of aging. Now, let's talk about the different treatment options available for presbyopia, starting with the most common and progressing to more advanced solutions. The first solution is reading glasses. These are the simplest solution and work very well for many people in the early stages of presbyopia. They're inexpensive and readily available, but they don't address the underlying issue and can be inconvenient to carry around and put on every time you need to read. The second solution is bifocal or progressive lenses. These provide correction for both distance and near vision in a single pair of glasses. They're a step up from reading glasses, but can take some time getting used to. The third solution is contact lenses. There are multifocal contact lenses designed specifically for presbyopia, which correct both near and distance vision. Some people find them more convenient than glasses, but they're not suitable for everyone and require proper care and hygiene. However, there are more advanced surgical options out there. The first surgical option I'll mention is monovision, LASIK. This procedure corrects one eye for distance and the other eye for near vision. It can be effective, but it's important to note that only about 50% of patients can comfortably adapt to seeing near with one eye and distant with another. It's also not a permanent solution, as your presbyopia will continue to progress. Now to my favorite solution, clear lens exchange, also known as refractive lens exchange. This is arguably the best and the most stable option for treating presbyopia. In this procedure, your eye's natural lens is replaced with an artificial intraocular lens or IOL. There are two main types of IOLs used. First one is a multifocal IOL. These lenses provide clear vision at multiple distances, allowing you to see clearly at close, at intermediate distances, and also far away. The second option is extended range IOLs. These provide a broader range of clear vision. They have a lower potential for glare and halos compared to multifocal IOLs. One thing I must mention is that glare and halos used to be more common with the old-fashioned multifocal IOLs. As the generations of multifocal lenses progressed, glare and halos became less and less prevalent. The advantages of clear lens exchange are significant. It's a permanent solution, eliminating the need for future cataract surgery. Cataracts will eventually form in the natural lens, which is removed in this procedure. It also provides stable, predictable results that don't degrade as presbyopia progresses. However, like any surgical procedure, it's not without risks, and it's crucial to have a thorough discussion with an experienced eye surgeon to determine if it's the right solution for you. As an eye surgeon who has performed thousands of these procedures, I can attest to the life-changing impact they can have. Many patients report a newfound freedom from glasses and a significant improvement in their quality of life. It's important to note that the best treatment option varies from one person to the next. One of the most important factors for success is choosing the right type of lens implant. There are a lot of lens options, and each one offers specific features that must be carefully matched with your individual eyes. Factors such as overall eye health, lifestyle, occupation, and personal preferences all play a role in determining the most suitable approach, from wearing glasses and contacts to surgical options. Regular eye exams are crucial, especially as you age. They not only help manage presbyopia, but also detect other potential eye health issues early. Don't let presbyopia hold you back from enjoying your daily activities or performing your best at work. Remember, clear vision at every age is possible with the right approach and care. If you'd like to learn more about these lenses, please click on this video here and you can watch that. If you find this video helpful, please subscribe to our channel for more expert insights on eye health and vision care.